Welcome to the Age Fit MD podcast. I'm your host, Dr. Z. And if you want to know how to maximize your training so that you get stronger, your bones get stronger, your heart and vascular system improves, and your flexibility improves, then you've got to push yourself outside of your comfort zone. And I'm going to tell you why that is from a physiologic standpoint. And so that way you're educated and you're ready to push yourself. Let's get started. One of the things that frustrates me when I talk to my patients and I ask them if they're exercising, and they'll say, oh yeah, I do a lot of walking. Okay, what else do you do? I love to garden. Okay, great. Are you taking supplements? Oh yeah, yep, taking supplements. I'm worried about your bone density. Oh, don't worry, I take vitamin D. I take calcium. Are you doing resistance exercises? No, but I do a lot of walking. So let's look at this from a physiologic standpoint, and you'll understand my frustration with this. Your body has evolved over thousands of years to preserve resources, and it has had to make decisions on where to put nutrients and calories and where it shouldn't. And that's because for thousands of years we lived in a time of restricted access to calories, as opposed to now where we have an excess of that. And so your body is constantly deciding, where do I lay this nutrient down? Where should I put this? Do I need this, or should I just excrete it out of my body? So let's talk about our bones, bone density. Your bones will not get denser or stronger unless you put them under resistance exercise. If you look at the anatomy of bones, it's almost exactly like concrete. When you look at a patio, it's a combination of rebar and concrete minerals that harden into rock. The rebar allows for flexion and bending type strength, and the mineral of the concrete allows for compressive strength. Same thing in your bones. When you're lifting a weight or pressing a weight over your head or doing a wall sit, your femur and your humerus are feeling that strain. And when it feels that strain, there are cellular mechanisms telling your brain and your body, hey, we're feeling some strain, we need to lay down more density to this bone. If you don't do that, then your bones actually serve as a source of nutrients. And if you're not taking in enough nutrients, enough calcium, vitamin D, then when your body needs that calcium, it just leaches it from your bones. So I see a lot of my patients that don't take this seriously. They just walk. They don't push their bones with resistance exercise out of their comfort zone, and they have a simple fall and they break their shoulder into 5 or 6 pieces and have a devastating injury after that. So that's the first concept about pushing yourself out of your comfort zone for bone density. You have to be doing resistance exercise. You have to do it at least every other day, and you should be doing it until you die. If you're 80 and you haven't been doing resistance exercise, you should start today because it's absolutely critical for bone density. Let's move on to strength and conditioning. For strength, this is common sense to everybody. If you don't push your muscles beyond what is needed, your body's not going to lay down more protein and make bigger muscles. If you take supplements and you even inject testosterone, but you don't lift weights and you don't perform resistance exercise, you don't gain muscle mass. It's only that strain out of your comfort zone beyond what you can normally do that stimulates your body to lay down more muscle and more strength. Let's go on to stamina. When you're exercising, if you're just walking, you're staying in what's called an aerobic zone, meaning your body's able to use oxygen, your heart and lungs are delivering plenty of oxygen to the muscles. There's no stimulus in your body to say, we need to pump harder, we need to have more vascularity, we have to have more lung capacity. The only way you do that is if you push yourself out of your comfort zone, like you would with, say, interval training, and you push yourself to the point that you start getting anaerobic, where you go beyond your body's capability to deliver enough oxygen, you chemically switch to burning lactic acid, and now you're anaerobic. And then when you drop back into the aerobic phase, you lose that lactic acid. But that's why high intensity intervals are so valuable. You flip between aerobic and anaerobic And that stimulation is what's going to make your heart, your lungs, and your vascularity improve over time. So this is critically important that you get in your mind that I have to push myself out of my comfort zone in order to make gains. And I'm not talking about something that's going to injure you. I'm not talking about box jumps. I'm not talking about sprints. I'm just talking about, for weightlifting, it's got to be a resistance exercise. It has to be upper and lower body. And I'm going to show you in future podcasts and video some key exercises to do no matter what your age. On the cardiovascular side, interval training. You've got to push yourself out of your comfort zone. Just 20 minutes a day would be plenty to make positive changes in all those areas that we talked about. And then I also want to talk about flexibility, mobility, and stretching. If you're not pushing yourself to where you're really feeling it and you're forcing yourself to make gains, then you're never going to get there. And if anything, with all the sitting and standing and sedentary things we have to do in our lives, your joint capsules, your discs, all your connective tissue is just going to remodel over time to where you're inflexible, your joint capsules are tight, you start rubbing on the joint surfaces, and then you start getting down into the road of degenerative joint disease and disc disease, etc. So I hope that you kind of get in your mind the framework that we're trying to teach you. And in each category, I'm going to be trying to push you out of your comfort zone so that we're driving improvement over time, so that you're aging fit, so that you're not undergoing a lot of these degenerative changes. And if you can accept that this is a fundamental truth, you're going to be a lot more successful than if you don't. So I hope you found that useful. We're really trying to educate you so that we can empower you to make the best healthcare decisions that you can. We want you to age fit and be as healthy as you can over time. Thank you.